My pleasure this morning to introduce Dr. David Kovacic. David, from a cardiologist's point of view, what are the dangers of untreated sleep apnea?
There are many dangers of untreated sleep apnea. The ones that are most prevalent in cardiology is increased incidence of atrial fibrillation and increased incidence of heart failure, both left-sided and right-sided, and really refractory hypertension, blood pressure that we just can't control with the standard medications. There's other complications aside from those, but those three make up a large volume of the population we see in our office every day. Even snoring has been associated with premature vascular disease in the absence of sleep apnea. So snoring by itself is actually an independent risk factor for vascular disease. My wife actually prompted me to get tested for sleep apnea. I've snored for years. It got worse as I gained weight. And finally she noticed that at nighttime sometimes not was I snoring, but I would snort myself awake or cough myself awake or stop breathing for a period of time, and that prompted me to be evaluated. I did try the CPAP first, and I had two major difficulties. One is that after wearing it for about 3 or 4 hours, I felt like I was being smothered and just had to take the mask off. The other issue I have is I do move around a little bit when I sleep, and when I would do that, I'd actually pull the mask off just a fraction of an inch. That would cause an air leak, and that would wake me up. Really, it's like a bulky retainer, and so I had braces when I was a kid, and it's not much different than that. It basically is something that after a period of a couple weeks you get used to, and it's a couple weeks because during that time you actually kind of adjust it to bring my bottom jaw forward, but really after a couple weeks you don't even notice it's in there, and if it weren't for the adjustment period it would be more like a couple days. So it's easy to wear, it's something that's easy to take care of. To this point it's been very durable and it's been effective. For me, the oral appliance has been very easy to use. It's something I haven't missed a single night of. I never made it through an entire night with CPAP. I tried 3 different masks. The people worked with me, they were great. I just couldn't do it. So it's night and day. It's improved the quality of my life in a couple ways. Probably the most important way is that I don't have to hear my wife every morning complain about the fact that she couldn't sleep because I was snoring next to her. But I have better quality sleep. I'm not as sleepy during the day. I really didn't have blood pressure problems, so I don't know if it's really had any effect on that. But overall quality of life, I feel better, my wife's sleeping better, and I know that down the road it's going to help reduce my risk of cardiovascular complications. I think you just give it a shot. I think that if you have patients who are motivated to seek treatment, patients that either weren't a candidate for CPAP or tried CPAP and failed, I think that you give it a shot. And you give it a shot the right way, have the right people who have experience with the products, work with the patient one-on-one. Just like everything else in medicine, I think if you individualize to the patient, you'll get the best results. I think there's very little to lose and lots to gain. I think that if you're to the point where you're talking about using an appliance, you've already been diagnosed as having sleep apnea or excessive snoring issues. And again, those are risk factors for problems down the road. So I think that when you look at something that has basically no risk, it just takes a little bit of your time to get it made and fitted to you, there's very little to lose, lots to gain.